We presented for the first time the primary outcome of our study looking at pregnancy rates in women with epilepsy compared to healthy controls. There's an idea out there, there's literature out there stating that women with epilepsy have more difficulty getting pregnant than other women just due to seizures, the drug effects, adverse effects of epilepsy itself on the reproductive system. So we were the first group, my collaborators Paige Pinnell and Jackie French, did a prospective study looking forward, keeping track of menstrual cycling, of sexual intimacy in our group of 100 patients with epilepsy compared to 100 patients with healthy controls. The happy results were that everybody got pregnant at the same rate. So we consider this finding to be myth-busting and reassuring for women with epilepsy, and a great counseling point for neurologists when they talk with women with epilepsy who are thinking about bearing children. They're worried about, the risk of not being able to get pregnant, and so what we found in our study is that they have a reasonable chance as much as anybody else in their age group. It actually came from data that shows that birth rates to people with epilepsy, men and women, are lower than in the general population. And part of our research question was, birth rates are not the same as infertility. Not bearing children, especially for people with epilepsy, can be accounted for by those with severe disabilities who are really not going to bear children. And also, unfortunately, the choice of some women, due to their illness, due to their medications, that they really don't consider that as an option for them. So I think that's another good message from our study, is that women with well-controlled epilepsy taking appropriate medications would have a very good chance of getting pregnant as frequently as their peers, as their sisters, their colleagues, women of the same age. And they actually had normal live births as frequently as the healthy controls. So it's a really positive message. It was a lot of work because it was done prospectively. Definitely. There's a huge body of literature about this. It's not complete, unfortunately, but we have a lot of information about which drugs are safer than others to be used during pregnancy. There is a lot of information about which drugs have more risk. Specifically, I'm just going to say this because it's so important, valproate and phenobarbital have a greater risk of birth defects and adverse cognitive outcomes when they are taken during pregnancy, adverse cognitive outcomes to the babies. Women with epilepsy should be counseled. It's part of one of the quality measures of the Academy of Neurology to be counseled about contraception and childbearing if you have epilepsy. But they should be counseled to try to move towards a safer drug, avoiding one of those two drugs, to take folic acid, a B vitamin, which has been shown to improve the outcomes of babies. And interestingly, recent evidence has shown breastfeeding actually improves the cognitive outcomes for women with epilepsy taking medicines. The reason for this, I think, is it's just the same as in the general population, where in the general population breastfeeding is associated with better intellectual outcomes. So there are definitely avenues to improve the outcomes, and this question of infertility was one of the unanswered questions in this realm of epilepsy care. And so I think hopefully we've added a little bit of valuable information to this body of evidence, and it'll help in the counseling.